Hello, everyone, and welcome to today's Reviving Veterinary Medicine webinar. We're so glad you could join us. My name is Derek Tyson. I am a regional sales director in the Southeast with Trupanion. We are very excited to sponsor tonight's talk as we know that the cost of care conversation can be a difficult one to have with a client, especially when a client doesn't know all that goes into your pricing structure. A simple conversation about pet insurance early in the pet's life could completely change the dynamic of that difficult conversation years down the road. Or as one practice owner once told me, one conversation about pet insurance on a puppy or kitten's first visit, and I'll never have to talk about finances again with that client. Before I introduce our speaker for the evening, I wanted to take a minute to give you the latest on Trupanion. Here at Trupanion, our mission is to help the pets we all love receive the best veterinary care. Two ways we are able to do that is with our patented Vet Direct Pay option, which allows Trupanion to pay an invoice directly to the hospital, allowing a client to pay only their small portion of the bill at time of checkout. This innovative technology helps with the client experience, client compliance and retention, pharmacy sales, credit card fees, and more. We also provide an easy way for hospitals to approach the topic of insurance through our exam day offer. This offer, upon activation, gives a client immediate coverage after an exam. This allows a client to experience Trupanion insurance with no upfront costs for 30 days, which then allows that pet parent to do their research and decide if insurance is the right fit for them. For more information on Trupanion, you can scan the QR code you'll receive in the post-event email. As a reminder, this session is approved for 1 hour of non-medical CE credit via RACE. Attendees must stay for the majority of the live session to be eligible. Certificates will be emailed to eligible participants within a week. A housekeeping note here, or a few housekeeping notes here. Participants can ask questions using the chat box or Q&A feature. A dedicated Q&A time will follow the presentation. For technical issues, attendees can reach out via chat. Let's get started. Now, I'm excited to introduce today's speaker, Dr. Marie Holloway-Chuck. Dr. Holloway-Chuck is a board-certified emergency and critical care specialist, founder of Reviving Veterinary Medicine, and a passionate advocate for well-being in the veterinary community. She's also the author of a recently published book, A Compassionate Calling: What It Really Means to Be a Veterinarian. Today, she will share practical strategies to help veterinary teams navigate moral stress, reframe cost of care conversations, and approach these difficult scenarios with clarity, empathy, and professionalism. Welcome, Dr. Holloway-Chuck.
Thank you so much, Derek, and thank you so much, everybody, for being here. We are so grateful for Trupanion's sponsorship of this session. This is definitely a topic that is weighing on the hearts and minds of so many of us these days as we navigate a time in vet medicine that we have not been in before. We are in a state of practicing where there's very high demand. The costs are higher in a lot of situations than they've been before, and people want to do the most that they have ever wanted to do to take care of their pets. So it is a pleasure to be able to talk about this and share this information that is so important with all of you. By the end of our time together today, I am hopeful that you will come away understanding and being able to identify moral stress in different clinical scenarios. I'm also hopeful that you'll be able to reframe cost of care conversations so that we can prioritize transparency and trust. And a lot of the strategies I'm going to give you are going to be really about having these conversations very early on in the pet's life, hopefully not when they come to me in the ER, so that they can be prepared for situations that can arise. And then, of course, we are going to talk about the role of pet insurance in supporting ethical decision making in veterinary practice and fostering sustainable care. This is a topic that has been of interest to me, particular interest for many, many years now. And I'm going to talk about that as the session goes on. And so before we
All
get
right.
started,
Sorry, Dr. Holloway-Chuck.
that's
I'm just
okay.
going to give you the floor.
Yes, thank you so much. So, before we get started today, I do want to share with everybody a story that I had early on, a case that I managed early on in my career, which was a situation where I was in my residency at NC State. You can see in the picture here, there's my team in the ICU. We've got a dear friend of mine, Samantha, one of my nurses on the left, who's performing an auto transfusion. My other nurse on the right, Beth, is helping. And then I've got one of our students in the background. And this was a dog that came into us into the ER and then, of course, very quickly into the ICU, who was brought in by a Good Samaritan. He had unfortunately been hit by a car. She, I should say, had been hit by a car, was witnessed to have been hit by a car, and nobody else was visible. Nobody, no owner was in the proximity. And so a Good Samaritan brought her into us, and we very quickly identified that she was hemorrhaging into her belly. She also probably had pulmonary contusions. Her oxygen levels were low. So we're giving her oxygen here. We had tried to fluid resuscitate her, and it became very apparent that she was going to need a blood product. Now, of course, our options are limited in terms of being able to give blood products to patients like this because it's very expensive. And of course, when we don't have owner consent, we're stuck in this place of what can I do to help this patient and stay within the limits and the boundaries of what we can offer essentially at no charge. And so that is what led us to do an auto transfusion with this dog. Sadly, we weren't able to stabilize her despite the transfusion, despite the auto transfusion. And so we had to make the really difficult decision in the situation. This was an ethical dilemma that was put before us, that was that there is this dog that is here who needs help, who's been hit by a car, who sustained trauma. There was no identification on here, but we presume that she was owned. She was in good condition. And we didn't know if there was an owner attached to her that might want us to pursue care. And of course, we were limited in the hospital with, I think, a $500 Good Samaritan fund at the time. And so ultimately, we had to make the decision to euthanize her because it got to the point where we needed to actually take her to surgery to stop her hemorrhage. And we knew that her prognosis was going to be quite guarded at that time. And so you can imagine the team really struggled with this. And ultimately, we were able to find the owners. And then that, brought out all of these other emotions, which were, how is the owner going to react? Are they going to be upset that we made this decision? Ultimately, the owner was so wonderful and understanding. He was very communicative that he wouldn't have been able to pay for this care on his own. And he was so glad that we had been able to make sure that she wasn't in pain in her last moments and euthanize her and relieve her suffering. So, what are ethical dilemmas? What is the definition of that? Well, these are situations where we as veterinary professionals have to balance competing obligations. So, we always have an obligation to our patient to prevent harm, to provide comfort, to do what we can, right? We also have an obligation to our clients. They are the ones that are paying the bills. They are the caregivers for these animals. They are the spokespeople for them. They are, by laws, they are the owners of these animals. And then we have our own ethical standards. So our duties as veterinary professionals, when we take our oath, when we agree, to practice veterinary medicine, even personally on a personal level, what our own standards are. And so sometimes those don't align, and that is an ethical dilemma. Now, a survey that was conducted several years ago in the United States of about 484 veterinarians demonstrated that half of them experienced ethical dilemmas every single week. And usually those dilemmas involved client financial concerns. So, of course, when we have a patient that we want to help, we have standards that we want to adhere to, but we have a client that cannot pay, that is going to present an ethical dilemma. 52% or half also identified ethical dilemmas as the primary cause of work-related stress. And this was especially an impact on those who identified as female and those who were less experienced practitioners. They were more likely to find these dilemmas very stressful for whatever reason. So what are some different examples of ethical dilemmas? This table comes from a paper that I published very recently called Walking the Ethical Tightrope, Balancing Perfectionism and Moral Distress in Vet Medicine. And so again, one of the biggest ones is treatment recommendations versus financial limitations, end of life decisions. So a veterinarian recommends euthanasia, but an owner wants to continue their care, or resource allocation. And we experience this a lot in the emergency room where we might have two extraordinarily urgent cases that both need our care and we are only one person. Or I can think of situations in the ER where I might only have one blood product in the hospital and I have two pets that might potentially need it. And, thankfully, there are often ways to get around this. We can source blood products from another hospital. We can, try to manage two cases at one time. But in that moment, even if just for a second, we feel conflicted and pulled in these different directions. So the reality is that ethical dilemmas are common. A more recent study, which was anonymous and distributed online, surveyed almost 900 veterinarians across North America. Many of these vets were practicing for more than a decade, and almost all of them had managed cases when an owner requested treatment at a time during which the veterinarian thought that it was futile, meaning that that treatment was not going to change the outcome for that animal. 94% of veterinarians had also been asked to do something outside of their skill set for financial reasons. So maybe it was to do a surgery that they didn't feel qualified to do, but the owner said, hey, I can't afford to go to XYZ specialty hospital, so I need you to do this. And then 93% had received an inappropriate request for euthanasia. So that was a euthanasia in a situation where the veterinarian felt it wasn't appropriate, that there was a better alternative solution. So again, if you have experienced any of these situations, and I'm certain that you have, if you've been practicing that medicine for any length of time, you know that you're not alone. And what we know about these ethical dilemmas is that they can lead to moral distress. So moral distress is a psychological response when a person recognizes that there is a right course of action, but because of some external constraint, they can't take that right course. So those external constraints might be financial limitations, which is something that we often see in vet medicine being a fee-for-service industry, clients' demands, clients wanting things in particular and being set on them, even though that might conflict with what is deemed right by the veterinarian. There might also be practice policies. I've talked to some veterinarians. I think this is much less common today than it was 10 years ago, but they really feel that their veterinary practice does not want them to refer. They want them to hold on to cases at all costs, even if better care could be delivered elsewhere. And so again, these situations, these external constraints on an individual are going to lead to distress if it prevents a veterinarian or any other team member from doing what they feel is the right thing to do. Now, one of the other things that we want to recognize is that if you are an individual who experiences perfectionism, you are much more vulnerable to moral distress during these ethically stressful situations. So let me explain. There was a study that was done in Australia about 10 years ago now that looked at Australian veterinarians' tendency towards perfectionism. How many of them experienced having traits of perfectionism? When they offered up this group of veterinarians a scenario that was ethically challenging or ethically stressful, those veterinarians that identified as having perfectionism were more likely to be distressed by these scenarios. So again, whether it's not being able to refer to a specialist for gold standard care or not being able to offer treatment and instead having to euthanize an animal, if you are anything like me, I consider myself a recovering perfectionist. If you are in the throes of perfectionism still, this is something you want to pay particular attention to. So not only do we know that moral distress happens, we also know that it has consequences. This isn't just something that we want to take note of. We also want to recognize that this is going to take its toll over time. So in that particular study that I mentioned just a moment ago of more than or nearly 900 veterinarians in North America, 70% felt moderately to severely distressed by being prevented from providing appropriate care. So that's pretty significant. That's, again, 2 out of 3 veterinarians at least. There was another study that was published a couple of years ago as well that looked at more than 1,900 veterinarians. And they found that moral stress predicted lower professional fulfillment, higher levels of work exhaustion, greater interpersonal disengagement, so kind of withdrawing from the team, and burnout. Once again, this was particularly common among early career and female identifying veterinarians. So, very, very interesting findings here. Probably not surprising to any of us, but really profound in terms of the consequences. Additionally, there was another study that looked at work-life balance among associates and practice owners, and it didn't matter what position you held in the hospital as a veterinarian. If you experienced moral distress, your work-life balance went down and your burnout went up. So again, really important things to pay attention to. So you might have heard a phrase being tossed around called moral injury. So this is a consequence of moral distress where individuals feel a deep violation of their ethical principles, almost like it is having an impact on how they identify as a veterinarian. When individuals feel moral injury, they shift into guilt. First and foremost, I feel bad that I'm doing this. I feel guilty that I'm, going along with this, so to speak. But then very quickly that turns to shame. This sense of I am a bad vet, or I am a bad person, or I am wrong in some way. I am flawed. And very often associated with the shame is this self-blame. What did I not do that I should have done in this situation? Taking it upon themselves. Did I not convince the pet owner? Did I not offer the right choices? Did I not find a solution within the restrictions of their budget? You can imagine, and I'm sure that you don't have to imagine, you can think back to when you've experienced this in practice, and it's not hard to recognize it. In my research on moral distress, I found it fascinating to learn that this is something that will build up over time. And so you can see based on this graph here that there is this distress crescendo. For those of you who are musicians, there's kind of that build up of distress that can happen in a situation. And when the situation passes, it drops to some degree, but you never really get down to baseline. That you have this, what they refer to as moral residue, where it just kind of stays with you. It feels icky. You're like, wow, this is a part of vet medicine. Like, this doesn't feel so good. And then the situation happens again. There's another crescendo. And then again, a non-return to baseline. So over time, you don't just feel these situations of moral distress, but you have this moral residue that is building up over time. And what we know when we talk to individuals who have a mental health background and who intersect with veterinary medicine, they will say that moral distress is one of the leading causes of compassion fatigue in veterinary medicine. So let's talk about that because you hear this term used a lot. A lot of people talk about compassion fatigue, but what does that exactly mean? Well, it is the emotional, social, and spiritual exhaustion that reduces our ability, desire, and energy to feel and care for others. Compassion fatigue is something that can impact any caregiving professional, whether you're caring for animals on the floor as an animal care attendant, whether you're caring for animals by connecting with their owners as a CSR. Everybody in the caregiving environment of vet medicine and in other caregiving professions can experience compassion fatigue. Dr. Figley, who was on the forefront of compassion fatigue research, who first coined the term compassion fatigue, he labeled it as the cost of caring, which essentially means caring so much and working so hard without recognizing and caring for a person's own needs. And so I want to be clear here that compassion fatigue doesn't mean you suddenly don't have compassion, okay? Compassion fatigue rises from barriers that keep us from providing the care that we believe is right. It's not that all of a sudden you don't care. It's that you care, but you can't deliver that care. Okay, so I hope that that makes sense to everybody. So let's talk about the financial factor because there's this obvious intersection between the finances of our clients and the moral distress that we experience in veterinary medicine. This was a research study that was published several years ago now, surveying more than 1,100 small animal vets in both Canada and the United States. 57% said that client economic limitations influence their ability to provide optimal care for their patients on a daily basis. Shocking. And I can only imagine that this has potentially increased given the cost of care increases that many of us are seeing where we practice. Client economic limitations were the key contributing factor to what respondents in this study attributed to experiencing moderate to substantial burnout. So again, it's this sense of just over time, over and over and over, when we are faced with these situations, not only can we experience compassion fatigue, but we can also feel emotional exhaustion and even cynicism, or that we're just not accomplishing anything meaningful in our work as veterinary care providers. So this was a very recent study that was published in the Vet Record that was a interview study that an individual published, interviewing individuals about morally stressful situations in relationship to client economic limitations. So one of the quotes that I pulled from the paper was, I had a 4-month-old puppy come in with a fracture, and the client was standing there with his pregnant wife saying, well, I can't afford even the x-rays. Unfortunately, we have to explain, well, look, I'm sorry, the only thing we can do is let her go. And I think that's a really difficult situation to be in. It's emotional for everyone. Receptionists were getting upset, the nurses were getting upset. Obviously, we didn't want to be in that situation either. So there is this challenge in these situations where I think we've all been there, done that, right? Where we are faced with these excruciating situations with our families where they just don't have the finances. And it could be a puppy, it could be a pet that is, middle-aged, it doesn't matter. But if they're not prepared, then we can have a really challenging situation on our hands in which everybody is impacted. So at the end of the day, veterinary teams will be facing these situations when the cost of treatment exceeds what the pet owners can afford. And what does that lead to? Well, again, like I said, emotional exhaustion, which is one of the symptoms of burnout, guilt, right? Feeling bad. Gosh, like I wish there was a way that I could treat this puppy, and helplessness. Like I don't know what to do in this situation. Do I pay for it on my own, which is something I know some veterinarians have done? Do we offer adoption? Like what do we do? And I think veterinarians may have to consider, of course, alternative, less effective therapies or even economic euthanasia. And in those situations, of course, it is the financial constraints rather than the medical necessity that are dictating the decision. And that is such a challenging space to be in. And so ultimately, there's what I refer to as this moral stress connection, where we have these financial constraints that inevitably lead to moral distress because we're doing things that we don't think we should be doing. And over time, that is going to build up to compassion fatigue. So, what are the different phases of compassion fatigue that we can experience as individuals? Well, early on in our careers, when we're first starting as care providers, we feel great. We're ready to solve all the problems and help all the patients and make a difference in all of our clients' lives. And it's not long before we start to experience these situations of moral distress. And then we enter the irritability phase where our enthusiasm goes down. We feel more tired. We are unwilling to discuss work as much because it just doesn't feel so good, or it brings up these situations. Some of us might start to develop a thicker emotional shield. We might even start to neglect ourselves and others. If we move on through the phases, we can enter the withdrawal phase, which is where we start to avoid work. We might even cope by making fun of our clients or our colleagues. We might avoid difficult cases or patient situations that might be triggering. We can even develop a numbness, which is, of course, when we're most prone to making mistakes. And then last but not least, the zombie phase, which is either a sense of complete helplessness, or more often than not, we see individuals who start to experience rage, where they hate everybody. They hate this profession. They hate their clients, their coworkers. Everybody is either ignorant or incompetent, and they just do not have patience for these situations anymore. They are completely running on empty. And I remember a situation that really sticks in my mind. I was working in emergency practice, and I came in early in the morning on the shift, and there was a parvo puppy that had come in overnight and was in isolation. And the puppy had been dropped off in the lobby of the hospital. Actually, not even in the lobby because the doors were locked. It was dropped off in the vestibule, like the where the sliding doors open and then they have to ring the bell. So somebody rang the bell, left the puppy, and took off, probably knowing that it had parvo and that they couldn't afford to care for it. So the dog came in. It was a little pit bull puppy, just like in this picture here. And it was the sweetest, sweetest little puppy. And it was so sick. And so the team overnight had already, gotten to work trying to resuscitate this dog. I came in, I got to work on it as well. And of course, very quickly, we had to figure out who's covering the cost and what's happening with this puppy. And so we ended up ultimately calling, of course, shelters and the SPCA and trying to amass as many resources as possible. Sadly, there was a parvo outbreak that was ongoing at the time. And so we weren't able to find the resources to save this pet. And so, unfortunately, we ended up having to euthanize him. And so I'll never forget this. I was in isolation, I was by myself, euthanizing this puppy with just tears streaming down my face. And I can tell you that I was not the only one affected. There was everybody on the team affected because everybody on the team is a caregiver. Our amazing front staff who have to tell the clients what their bills are and see the looks on their faces and help them out. They experience it. Our nurses experience it. Our TAs and our animal care attendants experience it. And I experienced it that day. And it really, really, really is challenging. So, what I can tell you is that there are so many layers to this experience, and I want to highlight an important one, which is this notion of empathy fatigue. I go back to what I said before, of course, which is the fact that we don't ever really lose our compassion. We are all innately compassionate beings. But what people often recognize is that compassion fatigue is probably a misnomer, and that it is more the empathy that is driving us to exhaustion. Empathy fatigue is when we have no more empathy to give. We can see that there is a person suffering. We can see that they are distressed, and we just can't even let ourselves get there. And that's usually because we have experienced too many episodes of emotional empathy. So there are different forms of empathy, and I think we can recognize these, and this is a step that we can take to try to help disengage a little bit in a good way, in a productive way. Cognitive empathy is the cognitive recognition of what another person is experiencing. I can see that that person is sad. I can see that they're embarrassed. I can see that somebody is frustrated. I can see that somebody is confused. But that's their experience, it's not mine. Emotional empathy is when I see that a client is embarrassed because they can't pay their pet's bill, and now I'm feeling embarrassed at the same time. That taking on of their emotions or their distress. They're distressed because they're being faced with the decision to potentially euthanize an animal. Then I start to feel distressed and that I need to do something about it. We want to find a happy medium here where we instead practice empathic concern. We see someone's distress or suffering, but we focus on how can I help? What can I do in this situation to alleviate this person or pet's suffering? One of the other ways that we can disengage from emotional empathy is to really assert those boundaries, to really make sure that we are disengaging, not that we are numbing and not that we are hyper distancing, but that we're recognizing this is not my distress. This is not my pain. This is not my struggle. This is not my problem to fix. And one of the ways that we can also make sure that we protect ourselves is to use communication as a preventative strategy. So I want to launch into the second part of what I want to share with all of you today, which is really looking at the role of communication in reducing these morally stressful situations, right? Being very clear, having open decisions with our clients to reduce uncertainty, to reduce these situations where they feel completely blindsided by an emergency broken leg that is going to cost thousands of dollars, right? Empathy, right? To acknowledge where our clients are coming from. That is going to build trust. Honesty, right? Being transparent in our communication is also going to ease moral distress. And then making sure that at the end of the day, everyone on the team is delivering consistent messaging. Team alignment really, really matters in these situations. We want to make sure that we are feeling all on the same page and that we are communicating that. So this was some really important research that came out of the one of the studies that I mentioned previously, which is communicating about cost. And in this particular survey, again, of more than 1,100 vets in Canada and the US, nearly every veterinarian surveyed believed that increased client awareness of costs would not only enhance pet care and contribute, it would also contribute to greater satisfaction, not just for clients, but also for veterinary teams. Talking about cost early and often so that there aren't any surprises. So I was very pleased when the AVMA came out with some guidelines for communicating with clients. They did a tremendous amount of research that was included in their Language of Veterinary Care initiative, where they wanted to find what owner preferences were when it comes to veterinary team communication. So they were able to distill it down into prompts based on research with pet owners across the United States to really demonstrate that the way we talk about veterinary care really can influence pet owners' perceptions about its value and about the cost. Two of the key takeaways were, number one, making veterinary care personal rather than telling an owner how valuable it is. Obviously, they know that veterinary care is important, right? They own a pet. They know that part of owning a pet means going to a veterinarian. But they don't want just any veterinary care. They want care that is personalized for them. The other thing is to show intention behind the care plan and its cost rather than just justifying the cost of care. And we'll get more into that, not just in today's session, but in a session, a part 2 of today's session, where we're going to dig even deeper into the communication around cost of care conversations. So the AVMA Language of Veterinary Care initiative really was aimed at helping clients to see regular checkups as opportunities to develop the relationship with their veterinary team. That will then allow their veterinarian to provide those personalized recommendations. And in the context of our conversation today, to also have discussions around cost of care, not just about the checkup that they are doing in that moment, but about all the costs that could be associated across their pet's lifetime. And again, we're going to dig more into some of these prompts and things next time. But for today, I really want to focus on these morally stressful situations when you know what's coming. The client their eyes are getting bigger and bigger and bigger, and it's like, how am I going to pay for this? Okay. So what I don't want you to do is to default to, we're going to send you down the road where it's cheaper, right? This is what clients do not want to hear. If our recommendations can't meet your budget, we're always willing to refer you to lower cost clinics or another practice that might be a better fit. It sounds like a reasonable thing to say, But on the client's perspective, according to the AVMA research, they feel like they're being shushed out the door. They feel like it's like, well, if you can't pay, head on down the road. Instead, they want payment options presented to them, right? This is where we communicate again early and often. We have lots of payment options that are available to help. Everyone here is committed to finding an option that works for your budget. That is another thing that they are that they really emphasized in the AVMA language guidelines is using the word budget instead of finances is absolutely preferred. Okay. So another thing that you might say is we can help you navigate payment plans, the option to have a savings account, or even better, pet health insurance as strategies to be able to cover some of the costs that might come up during your pet's lifetime. Now, another thing that we want to avoid in these situations is overstating the potential for preventative care to basically make sure that any future cost is not going to be an issue, right? So this is an overstatement, right? It's no secret that bills can become thousands of dollars to treat serious illnesses, but preventative care can help avoid these costs entirely. There is no preventative care that is going to help avoid the costs that a pet will incur over the course of its lifetime. But what we can do instead is to connect payment options to cost-saving preventative care, right? So, for example, asking now about the options available to you can help ensure your pet is getting the routine care they need, which often ends up saving you money in the long run. Okay, so really linking that to the future. Or pet health insurance is one option that can help defray the cost of veterinary care, in some circumstances for routine care, and in many circumstances for emergencies. So let's talk a little bit deeper about pet health insurance as a systemic solution. I wrote a blog post about this, gosh, I think this is close to 8 years ago, how pet insurance can help the mental health of veterinarians. It was like this light bulb moment that I had being in clinical practice at the time. It felt to me like more and more people were taking advantage of insurance. And I was really starting to recognize, as an emergency and critical care specialist, the impact that that was having on me when I would be faced with two very similar situations with families, and yet one would have insurance and one would not. And the one that wouldn't was always more conflicting. There was always that element of moral distress, that extra layer of, gosh, how do we navigate this? What do we do? We've got to pick and choose. We've got to have more conversations. There's more nuance. More people, need to be involved because there's people paying the bills and there's other people attached to the pets. And everything was just more challenging. And so, not surprisingly, this is me and my dog Vivian. And it's not surprising when I adopted Vivian, she was 3 years old. My daughter was 1 year old at the time. I finally felt ready. Bethany was old enough that I was like, okay, I feel like I'm out of the woods of like postpartum care, that I can actually have another pet in my life. And so I adopted Vivian. She's just, one of the big loves of my life. And as a 3-year-old standard poodle, I was like, okay, there's so many things that can happen. She could get Addison's. When she gets older, she could have a GDV. Like, I'd had a dog before, a standard poodle that had allergies and all of these different things. And so I knew I needed to get pet insurance, especially I don't own my own practice. I do work in practice, but I'm mostly locuming. And so there wasn't an easy situation that I could see being able to either get very no cost or low cost veterinary care, or to be able to afford that care on a whim should an emergency arise. So I made the decision to get pet insurance, and I honestly think it's one of the best decisions I've ever made. And in full disclosure, it is Trupanion who is my pet insurer, but that was a long time ago before we planned to do this webinar. But nevertheless, I just feel so grateful for that. And I'm not going to lie, I don't want to get too off base because we have lots to cover before the end of the presentation, but Vivian was just at the hospital a couple of weeks, well, a month ago now, for significant GI distress. And I'm so grateful that I had the insurance coverage that I did. She got endoscopy, we got a diagnosis, and she's doing much, much better. So, how is pet insurance a tool to reduce moral stress? Well, this can offer a financial safety net for the clients and for the team. There is research that I'm going to show you in just a moment that it does reduce euthanasia related moral distress, and it supports more consistent ethical decision making. We're making decisions more based on what's best for the family from an emotional and mental perspective versus what's best for their finances or their budget, of course, being the verbiage that they prefer. And at the end of the day, the hope is that this will promote access and equity in veterinary care. So how does it support ethical and sustainable care? Where again, I will say that it can reduce economic euthanasia. I'm going to show you a study for that in just a moment. It reduces moral distress and compassion fatigue among veterinary teams, and it can support team well-being by aligning care decisions with values. We don't want money to be the cause of the decisions that we're making or the root of the decisions we're making. We want it to be values driven in terms of providing the best care. And it's, of course, backed by research from veterinary and human healthcare. There's research in human healthcare looking at access to care in communities where there's high uptake of insurance versus not. Of course, here in Canada, we have universal healthcare, but nevertheless, in other communities where it's not so, there is a big, big difference in those who have insurance versus those who don't. So at the end of the day, we want to see fewer treatment compromises because insured clients will choose life-saving options more often, and reduced burnout because there's fewer cases that hinge on affordability, so that emotional load decreases. So I mentioned studies that demonstrate reduced euthanasia. There was research that came out decades ago now that demonstrated, based on a survey research, when they presented situations to families where there was going to be costs associated with the situation, they asked these families, at what point would you decide to euthanize? Now, this was 20 years ago, so of course we'd have to inflation correct these numbers. But the threshold for those families that did not have insurance at the time was euthanizing when it got over about $576, of course, that being the mean, versus with insurance, it was about $2,000. So a higher threshold. Now you're looking at an individual that might have a $500 or $1,000 deductible. And so there's a lot more wiggle room when they're looking at that threshold for euthanasia. Another fascinating study came out of Australia, once again, looking at GDV dogs that were coming into the hospital, and they started to see a trend, and they looked at this trend retrospectively, and they found 0%, none of insured dogs were euthanized before going to surgery for GDV versus the majority of dogs that weren't insured ended up getting euthanized. So again, this took away that decision making in the senior part of this pet's life where they've got a GDV, this is life threatening, we need to go to surgery, it's going to cost thousands of dollars. If they've got insurance, it's like go. And if they don't, many of those owners are opting for euthanasia. Now, I do want to highlight that as I've done the research and as I've lived the experience of having more access to pet health insurance in veterinary practice, I do believe that there are some things that warrant additional conversation. I do want to highlight and recognize that not all families can afford pet health insurance. There are premiums that may be outside of the budget of what some families can afford. Now, again, all of this is based on coverage, what sort of plans that they might have, what their deductible might be. So there's many ways that the pet health insurance can be nuanced for that individual, but I want to hold space for those individuals where this is something that just will be outside of their family budget on a monthly basis. I do think that there is the perception of upselling, right? There's this fear that, oh, my pet owner has insurance. Well, I'm just going to prescribe all the diagnostic tests. or that we might overtreat, that there might be excessive diagnostic testing or even unnecessary care. And this is definitely something that has come out in some research studies where they have interviewed veterinarians. They've given them different scenarios where there's been an insured pet and an uninsured pet. And indeed, the options offered to the insured pets do differ from the options offered to the uninsured pets. And so we want to be mindful of that as veterinary care providers as well. And of course, at the end of the day, if not everybody can afford pet health insurance, are we increasing the disparity between those who have access to veterinary care and those who don't? So, some subtle things that I think to keep our conversation balanced and open, I want to make sure that we're highlighting those as well. But at the end of the day, the goal isn't to use insurance to do more, it's to enable us to do what's right. Okay, that is what we are striving for. And that is what has really helped me in the ER. I don't need to do more here, but I need to do what I feel is right to help this patient in this moment. And so, how do we reframe these pet insurance conversations? Well, we normalize it as a part of pet ownership. With the promotion of my book over the last several months, I've had the opportunity to have a lot of conversations with pet owners on news programs and in articles and other things. And I have been speaking a lot about pet health insurance because I think pet owners need to know about this. This is a part of owning a pet. If I have a friend that tells me we're going to adopt a cat or we're getting a dog in the holidays, the first thing I ask them is, are you getting pet health insurance? I have pet health insurance. I feel so strongly about this. And at the end of the day, this is not about selling. This is not about business and money. It is to some degree, of course, but from a compassionate perspective, right? We don't want to see anybody in a situation where the cost is determining the care. So we want to integrate these conversations early during those puppy and kitten visits, during wellness discussions, when things are happy and when people are planning for the financial care. It's like when you get a car, what are all the things you're going to need to do to maintain that car? Because buying the car isn't the only cost that's going to be associated. And we normalize it, right? So verbiage like this, just like we plan for vaccines and wellness visits, we also encourage planning for unexpected health events. Many families consider insurance a standard part of caring for their pet, much like having human health insurance. We also want to emphasize the compassion like this. We bring up insurance because it helps ensure your pet can get the care they need when it matters most, not just when we plan for it, right? We want to focus on making decisions that prioritize your pet's health without being limited by cost in a crisis. And that's the biggest thing for me. As somebody who works in the ICU, I see the bills that are upwards of $10,000. And I know for me, I know my financial situation, and I know that I can't afford that on a whim. And so that is why, again, I made that decision. And I think it is okay to talk about that and to share those decisions yourself with your pet owners and clients. During wellness visits, we often discuss what to expect financially and how insurance can help protect both your pet and your family. Or planning for the future can reduce stress for both pets and their families and helps us provide the care we know they need. And then finally, if you'd like, I can share how insurance has helped my own pet. It's part of being prepared for the unexpected, right? Not everybody might want to hear that, but very often people do want somebody's firsthand experience. So we know based on research that is done, this was a survey study looking at more than 300 uninsured pet owners in the United States. It was published in the Vet Record, where they provided information both on veterinary costs and cancer risk in their particular pet, in their breed. And what they found is that there was a 12% increase in willingness to purchase pet insurance when they knew the costs and the cancer risk. So when they have that information, when they know, hey, if your pet is ever hit by a car, these are the potential costs, or hey, if your pet ever gets diagnosed with with food allergies or seasonal allergies, these are the potential costs, then it puts it into perspective. This was another research study that was done in a US specialty hospital waiting room where they surveyed pet owners. 80% of those who had pet insurance were satisfied, and more than 70% would recommend their plan to a friend. The big hesitation on recommending the plan in this particular study was the cost, recognizing that the cost may not be feasible to everyone or it might not fit everybody's situation. So I must speak to my own experience, of course, which is in the emergency room, right? Pet insurance during emergency visits. I can't even tell you how many times somebody asked me about pet insurance in the emergency room. And on the one hand, I'm so glad that they're asking because I still want them to get it. But on the other hand, I'm like, why did you not have this before? Because now this is a pre-existing condition for your pet. So we want to acknowledge the urgency and the stress. There's emotional stress and there's financial stress. So it is okay to still talk about insurance during emergencies. That's probably not the only emergency that pet is going to have throughout the course of its life. So we want to highlight how insurance can alleviate the distress in these emergency situations. Maybe they're coming in for something minor. Hey, just so you know, if there ever is a major surgery or if next time Fido needs hospitalization or he gets diagnosed with something, having pet insurance might help to offset these costs. And so again, some verbiage to share with all of you. Emergency situations are stressful, both for families and for us as vets. I tell people that all the time. This is stressful for me too. If your pet has insurance, it can relieve that agonizing cost discussion and allow us to focus on treatment. And then I might even share when my own dog needed hospitalization, insurance allowed me to make care decisions without hesitation. I know for me, most recently with Vivian, I knew she needed to be in the hospital. I was like, we're going, there's no hesitation here. And I knew that she was probably going to need endoscopy. And so for me, there was the option to wait and to kind of see. And I was like, no, because I need to know, does she need medication? I don't want to be shooting from the hip. This is why we have insurance, right? To do the best care that we can. So key messaging tips for any visit. We always want to frame insurance as a tool for care, not as a sales pitch, right? We're not using this to be able to charge more to our clients or to get them to do more testing. This is to ease their mind, okay? We also want to tailor the conversations to the context of the clients and what their needs are. Some clients do not have a need for pet insurance. They have the financial means to pay when they need to pay, and it's not an issue for them. Great, right? So getting a sense for what your client's financial situation or budget is. Reassuring clients that having insurance supports those best practice decisions. If you want to do the very, very best every time for your pet without hesitation, insurance is one of the tools that you can use to do that. And again, using personal stories where it's appropriate. We never want to, again, feel like we're persuading somebody, but that can help build trust and really normalize it for our clients as well. So for example, many families find that insurance gives them peace of mind. I personally insure my pets and it helps me make decisions without worrying about cost. Or this isn't about spending more, it's about being prepared so we can focus on your pet's health when emergencies arise. And I want to share with you a quote that was published in my book. So at the beginning of every chapter in my book, I have a quote from a veterinary professional that dovetails with the context of what's shared in the book. And this quote comes from Dr. Jessica Hurd, who shared, as a cancer survivor myself and mom to a teenage driver, I have different feelings about insurance than I used to. When faced with catastrophic choices, it allows us to concentrate on what is best for our loved ones. At the end of the day, I get goosebumps. That is the takeaway, right? And so I do talk a lot about moral distress and insurance in my book. So if you're interested in digging deeper into these topics, A Compassionate Calling, What It Really Means to Be a Veterinarian is available now. So check it out. Great stories, great unpacking of the research to really dig deep into, what this really is all about. So I want you to think about today, what is one action that you could take or advocate for that might reduce your moral stress in practice? Just one thing. That's all you need to take away from today's conversation. So I know we're coming to the end, and I've covered a lot. I had so much I wanted to share with you. I feel so passionately about this topic. I want to thank Trupanion once again for their very generous sponsorship of this session. Without them, this session wouldn't have been possible. And I want to make sure that you know that we are coming back for another session in December, also sponsored by Trupanion, communicating about money with compassion and clarity, navigating conflict in cost conversations. I'm going to talk a lot about how we talk about money. When conflict arises, how do we navigate it? How do we bring it up? What do we do when a client gets angry about a bill? We're going to unpack all of that. So I really do hope that you will join us in early December. You can register for that now. Now, I'm more than happy to answer questions. I feel like the chat is blowing up. I haven't been able to look at most of that. I know Jamie is taking care of that. If you want to
Yeah.
direct a question to me via social or email, please reach out to me anytime. And I'm gonna invite Derek to join me again here, and please feed me the questions. What can I do to help?
All right. Having trouble turning the video back on, but that's all right. You still hear my voice. Thank you so much, Dr. Holloway Chuck. I thought that was extremely insightful, engaging. It's obvious you are very passionate about this topic. We did have several attendees leave comments. Here we go. We had several attendees leave comments during your presentation. It's obvious many of you have dealt with situations similar to the examples that you shared with us. We also had a few good questions from the Q&A. First, from Morgan. How do you help prevent the zombie phase? Because I feel like there are times that I'm close to it being there, but I do love what I do.
Oh my gosh, such a great question. I've been in the zombie phase. Actually, for me, it usually shows up more, it's zombie phase, but it's really rage. In times in my career, I've gotten very, very angry about really intense cases, and it's very out of character for me. And that's for me when I know. And there's so many things that we can do to mitigate compassion fatigue. When you find yourself in those earlier stages, that's where you want to get help. The very best help that you can get when you are really struggling to navigate those morally stressful situations is to talk to a mental health professional. So, talking to somebody, unpacking those emotions that are building up for you, figuring out, strategies like self-compassion, self-forgiveness, even just naming those situations of moral distress can be very helpful. We call it name it to tame it, where we recognize, hey, this is a morally stressful situation. And it kind of, it alleviates the emotion, because otherwise we just come home and we're like, I hate my job, vet medicine sucks. And it's not the job and it's not vet medicine. It's just that we have these situations sometimes that we're exposed to that can be particularly challenging. So, mental health care, name it to tame it, connecting with loved ones and peers. So, having that sense of social connection, self compassion, self forgiveness, recognizing that this is normal. These situations, as much as we don't want to go through them in vet medicine, we do, and you are not alone. And those are some of the biggest strategies that I would recommend.
Awesome. Thank you so much. And then we had another one from Cassandra. And I'm going to condense her question here a little bit. She wanted to know how to help clients when financial options like care credit or scratch pay don't accommodate clients with poor credit, and those clients tend to get frustrated.
Yeah, been there. It's not uncommon. I know I did a lot of locum work in inner city Seattle, and so we would have many low income individuals or no income individuals that didn't qualify for scratch pay or care credit, didn't have pet health insurance, nothing. And it is very frustrating, and I feel for them. And very often their pet is their sole sense of comfort. And that would be a one situation where unfortunately it doesn't always help us in an emergency, but we're having a low or no cost option to refer those individuals to is probably the only way you're going to be able to help them. So in Seattle, for example, we knew what the Seattle Humane Society could offer. We knew the low cost clinics in the area. We knew when there was parvo outbreaks, who was hosting vaccine clinics when for free, for example, for unhoused individuals who had pets. Um, so having those options, I really do also think it's a really great idea for individuals to, for practices to have a fund that they can pull from in those situations. You want to be, of course, really careful about how you're using that money, when you're using that money, but having a fund where if we have a situation where we know we can save that animal, where we know that even a little bit could make a difference, can we use some of that money in those extenuating circumstances to really help? As far as diffusing those challenging conversations when they get angry, we're going to unpack that in December. So I'll stop there and I'll encourage you to come back. But there are definitely ways that we can de escalate when clients get angry because they do get angry when they know that they can't pay. And it's not because they're mean people. It's because the anger is covering up the embarrassment, the fear, and the frustration that they're feeling, knowing that they want to do everything they can for their pet and that cost is going to be a barrier. So we'll talk about that in December.
Great. And I know we're coming up on time here, but I did want to mention one last question, more of a comment that feel like you could bring some really good insight here. And this one says insurance plans are difficult for small rural clinics to implement because the payback to clients is oftentimes less than what they would have paid us directly. Our average visit cost is $260. Seems like insurance makes more sense for big cities or emergent cases, but doesn't help with mild issues or preventative care. I think that it's um, uh, yeah, so it doesn't help with preventative cases. So how would you respond to that?
Well, I mean, I don't have the experience of working in rural general practice or mixed animal practice, but what I can tell you, based on what I know and what I understand about pet health insurance, is it totally depends on the pet health insurance. It depends on the
Mhm.
coverage. There's so many different things to consider. There is, first of all, what the client's deductible will be, what sort of coverage they have. Is it emergency or injury only, or does it cover illnesses as well? When you go to a veterinarian, it doesn't matter where they're practicing. If suddenly your pet is diagnosed with, let's say, an immune mediated condition and they need months and months of treatment for, immune mediated hemolytic anemia, for example, I can guarantee you it's going to be more than that initial $200 visit. There's going to be a workup, there's going to be blood tests, there's going to be monitoring. Once that diagnosis is made, and I'm speaking to my own policy, of course, that I have with Trupanion, for example, but when you have that illness coverage, that illness is now covered for the lifetime of the pet. Now, with some insurance companies, there may be a cap, there may be, covered, maybe not for the lifetime, but up to a certain amount, a dollar amount for that illness. But we're not just talking about, one-off visits here. We're talking about
Sure.
ideally coverage for emergency significant things like surgeries and like a stuck foreign body, an
Mhm.
enterotomy surgery, or something, hemoabdomen, something like that. And I've got the QR code here so that if you have questions, direct them to the folks at Trupanion because they can talk through all of this with you and with your clients to find the policy that works best for them. And that goes for any pet health insurance company out there. But I hope that helps answer the question. Derek, you probably got some insight there as well.
Yeah, absolutely. And everything you said is correct. Just a reminder that Trupanion does base our pricing based on the average cost of care for a certain area.
Mm,
So
okay.
your prices in Seattle are going to be much different than rural Kentucky, right? It's just going to be different. It's all about based on the cost of care for that area. So it should relate more closely to what that area is. So just keep that in mind. And then again, we have the ability to pay a claim directly at checkout. So that client doesn't have to worry about putting it on a credit card and then getting reimbursed. This helps them pay for it immediately. So again, if I'm on a fixed or limited income and I know that I don't have to come out of pocket and put something on a credit card, I'm more willing to kind of budget for that one item as far as my pet is concerned, if anything goes wrong. So it does certainly help there. So we'll wrap it up. I know we're at time here. I'm very, very fortunate to work for a company like Trupanion, who does sponsor events like this that cover meaningful topics in our industry. As a reminder, to learn more about Trupanion, connect with a local territory partner and learn more about how insurance can have a positive impact on cost of care conversations. Just scan the QR code that you see on the screen there, and it will be sent out in the post-event email. We also want to thank all of you for joining and participating in this important conversation. Your commitment to improving well-being in veterinary medicine is very inspiring. If you are eligible for CE credit, you will receive an email within the next week with your certificate. And a reminder, a recording of this webinar will be available on Reviving Veterinary Medicine's YouTube channel, and it's at Reviving VetMed. Again, that's at Reviving VetMed. CE credit will not be awarded for viewing the recording, just an FYI there. And lastly, if you'd like updates on future veterinary wellbeing events, please subscribe to the Reviving VetMed newsletter at revivingvetmed.com/newsletter. Again, revivingvetmed.com/newsletter. Thank you again for being with us today. Take care, stay well, and we look forward to seeing you at our next webinar in December.